Hello, this is Dr. Marianela Medrano, founder and executive director of Palabra Counseling and Training Center, a holistic psychotherapy center in Stamford and in New Haven, right here in Connecticut. And we really strive to promote healing for the whole person. And with that in mind, we have created a series of workshops with local talents, with reputable providers from here in Connecticut, with the idea of helping people create a healthy living style that they can enjoy and happily live with. So for that, we have today Dr. Diane Hayden, who is going to be talking about actually the first workshop of this series that will be taking place in June 10 in our Stamford location. And she'll tell us a lot about that particular workshop. Let me just tell you a little bit about her before we start. She has a PhD in exercise physiology, and she is also the creator and editor of Natural Nutmeg, which is a free, and that's the emphasis, health and wellness magazine that provides information on nutrition, fitness, natural therapies, organic products, and sustainable living. And also, the other thing that is so important about the Natural Nutmeg is that it provides a directory of holistic practitioners from this area, from all over Connecticut. So thank you, Dr. Hayden, for creating such a wonderful directory of services. And welcome to this time with us.
Thank you.
Yes,
yeah, thank you so much. I'm happy to be here.
One of the things that I wanted us to do, because I want to focus our conversation in both wellness, but also what you're going to be doing in June 10. One thing that I forgot to say about you is that you are the co-author of the Weight Loss Puzzle Finally Solved, which is an ebook that individualizes care for people. And that is actually the title also of the workshop you're going to be doing with us. So for weight loss, we know that the person's ability to self-regulate it's a big part of the process. And we also know that self-regulation determines people's ability to be successful, and that part of self-regulation, a big part of it is the capacity to control our willingness, our power, willpower, and which I guess the best way that psychology has described the willpower is that it's sort of like an exercise, a muscle. That if it doesn't get regularly exercised, it loses power, it loses potency. So I'm imagining, and I don't want to speak for you, but I'm imagining that part of the weight loss process has a lot to do with willpower and the person's ability to self-regulate. So can you give us some idea of what will you say to someone about exercising the muscle power of willingness?
Yeah, you're absolutely right. And actually, not only do you have to exercise it, you have to be careful that you don't over exercise it, because we actually have limited amounts of willpower. And this goes for anything. I mean, not just losing weight. It could be towards accomplishing any kind of goal, whether it's you have a business or even in relationships or, pretty much all things that are related to you working towards accomplishing this goal. You need to be able to manage willpower, exercise it, but also make sure that you reserve it as well. So it's really interesting. This is a fascinating area for me. One of the reasons why I wrote this book with Dr. Frank Aida, who's the naturopath that I work with, is that I've been studying or in the weight loss industry for, more than 25 years. And it amazes me why some people are successful and some people aren't. And what I finally realized was, I would teach, this was going back to my grad school, I would teach people how to exercise, how to eat, different eating programs, different exercise programs. I would teach them about, hormones and all kinds of things. And I finally realized that it wasn't that people needed more education. They didn't need to know what the next fad diet was. They didn't need another exercise program. What they needed to understand was how their mindset either helped them or worked against them in terms of getting them or making them successful, or their ability to be successful. And so then I really got into this whole realm of studying mindset, which is even more fascinating, just how your brain works, related to anything really. But specifically weight loss. And so, what you said about willpower is absolutely right. It's like a muscle. And yes, we do have to exercise it. But what I've also seen in studies is that you have to conserve it too, because you have limited amounts of willpower, let's say, every day. So basically when you wake up, think of it like as an 8-ounce glass of water. So you have 8 ounces of willpower. Every time you use that water goes down a little bit. And so you have to allow yourself opportunities or situations where you give yourself a break. Like, think of it in terms of exercise. If you are, training for an event, whether it's like a marathon or, a bodybuilding event or whatever, you're not going to run 20 miles every day. You kill your body. You have to take days off. So even with things like, eating a healthy diet, you have to allow yourself opportunities to have things that you enjoy. I'm not saying that means have bad things, but have things that are healthy that may not necessarily, be on the diet, but allow yourself something that you enjoy so that you're not constantly battling yourself in terms of your willpower of having to stay into this focus, this small little box, because it's not going to work over time.
So that's so interesting, right? Because we have this idea that, or most people who want to lose weight, they think it has a lot to do with their ability to have a very powerful, self-regulation. But you're saying you're spinning that a little bit in the sense that, I guess, is the Buddhist concept of the extremes are always not too helpful for us, and that there is a middle pathway which allows for things to be transformed, right? So it's different here.
Right. I think it's the equivalent of saying it's a journey. It's a lifestyle. You didn't gain 50 pounds or 100 pounds in 2 weeks, but yet people think that they're going to be able to lose that in, this short amount of time. It's just like anything else. Like, it took time for you to get to this place. It's going to take time for you to get back to a healthier place. And I think people just need to realize that and accept it, that this is a journey. I'm going on a journey to get to a healthier lifestyle that I can maintain on a regular basis. It's not about doing some crazy diet that's going to restrict me from eating everything that I love. It's not about only eating one food group. It's not about killing myself at the gym, exercising for hours. You can't, like, none of those techniques, which have been taught in the weight loss industry, unfortunately, but
Right.
none of those techniques work. It's all about moderation, whether it's what you're eating, the exercise you're doing, the supplements you might be taking, and just how you think about it in general, like your mindset perspective. Every day, you got to wake up and do your best to do what you need to do to reach your goal. And some days you're going to go off that. That's purely natural. Some days you're not going to exercise. Some days you're going to have, whatever it might be, that piece of cake. It's going to be somebody's birthday party or, an event, a holiday. You're going to have some of those things. You're going to have a glass of wine. And that's okay. People, I think, have gotten into this place where they feel like, oh my God, if I do that, I'm a bad person. I went off the diet. I might as well just forget it. And they throw everything, out the window. But that's not the road to successful weight loss and fat loss. It's every day doing the best you can, knowing that you're going to have those days where you're going to go off, your program. Totally fine. It actually helps you restore your willpower to the next day, doing what you normally would do.
Mm-hmm. And I think what you're saying about the mindset is so important, in the sense that, and so, I mean, part of the reason I invited you to be part of this series is because the work that you are doing seems to be very aligned with what I'm doing myself with the mindful eating, which is helping people restore a better relationship with food and, with life in general. And it seems like that when you talk about the mindset, you're inviting people to look at that kind of thinking, right?
Exactly. Yeah. I think that is the biggest missing piece in any weight loss or fat loss strategy. I think that's where people are really missing the mark, is not talking to clients about, or patients about, mindset and how important that is. Because to me, that could make it or break it. I mean, you have to every day wake up and get your mind right about what you're doing, and keep in mind, why do I want this goal? Like I used to work with a lot of weight loss surgery patients many years ago. And it was interesting because one of the things that I learned from the behavioral psychologists that they were working with was that there are some people that don't want to lose weight. There's a benefit for them not to lose weight. And it completely changes their whole life when they do. Relationships break up, it changes their job situation. And people are scared of that with good reason. It's like your whole life is changing, essentially. So you need to look at, if you've been unsuccessful with some goal, whether it's weight loss or whatever, I think I always try to get people to come back to look at, what is it that you really want? Do you have the right perspective or mindset around this? Is this something that you want? Because if it is, then you have to look at, why do you keep sabotaging it? Why do you keep doing things that don't progress you to your goal? Or you're able to do it for a certain amount of time, but then you can't stick to it and you give up.
Right. And that is so true. I mean, as a psychologist, I get a lot of individuals who had that problematic relationship with having lost the weight, especially people who had undergone extreme procedures and not finding themselves in that new persona. So that's such an important point that you are highlighting. And along those lines, I know that, as you said before, you've been doing this for a long time. Although looking at your face, I wouldn't think so.
Thank you.
But why don't you tell us a little bit more? You do mention some of the missing pieces in the weight loss puzzle. Can you tell us some others that? I know you're going to be talking a lot about that on June 10th, but how about giving us some other missing pieces in that puzzle?
Yeah, definitely. So Frank and I call them fat loss myths and mindset shifts, because again, it's really about, getting yourself in the right mindset in terms of how you think about weight loss. And there's a lot of information out there that really has misled people in terms of what it takes to successfully lose weight, but more importantly, to maintain that weight loss. And it's funny to hear from an exercise physiologist, but one of the biggest myths is that you need to exercise extreme amounts. Mm-hmm. And that's just not true at all. In fact, we actually teach people to exercise less. And I know that people are going to be like, what is she talking about? Right. Because no one talks about it. Everybody said, the doctors tell you, oh, you got to do at least 30 minutes of cardiovascular exercise every day. And, you have to do all these crazy types of fitness programs. And it's really not the case at all. In fact, it can actually counteract and stall your weight loss, because what's happening is if you are over exercising, your body starts releasing excess cortisol. And what does cortisol do? That tells your body to store fat, because it thinks you're in some type of fight or flight or stress situation, and it wants to preserve resources. So it actually tells your body to release insulin, which tells your body to store fat, and you can actually gain weight if you're exercising too much, which I know it sounds crazy, but we've got so many studies to show that that is the case, and even our own case studies from people that have been going through our programs. So exercise is a big one. A lot of people think that they need to starve themselves, or they need to go on these, low fat diets. That's another huge myth. We need fat in our diet. And for a long time, there was all of this, stuff going around the health and weight loss industry about how fat was so bad for you, and it caused heart disease and all this stuff. And now there's research coming out to show that that's not the case. We need healthy fat in our diet. And so on June 10th, I'll talk about what kinds of things should we be eating to facilitate weight loss and to keep it off. But those are two big ones, definitely. What we choose to do for exercise and what we eat. And then, again, I have to come back to the mindset, because it's really just, I think the biggest factor that's out there is, do you have, how do you think about things? Do you have a fixed mindset, or do you have a growth mindset? And I'm going to get into what that means at the workshop, and we'll do some exercises and people can figure out which mindset they have. But the coolest thing about it is that you can change your mindset. And how do we do that? So I'll give some examples of great books to read and that kind of stuff. But there's a lot of research coming out now about how important that is to have a growth mindset, and how people, that's really what the most successful people have in terms of how they've been able to, set goals for themselves and accomplish them and maintain it.
It's such a relief to hear you. Basically, you're talking about kindness, towards ourselves in keeping in mind these things, right? It's not about hating a particular food. It's not about punishing the body. It's about practicing kindness towards ourselves. Can you touch a little bit more on the mindset and the process of change? I'm in the business of
it's fascinating.
Move in the direction that they want in their lives. So whenever I have the opportunity to talk to other practitioners, I always ask this question about change, and how do you think people change in your experience, paying attention to mindset? Like, what is there a correlation? I think you pointed to that, but can you say a little bit more about mindset and the process of change and how people change?
Yeah, exactly. There's a ton of research on that too, and that's fascinating, because I've looked at it in my own life. Like, I've looked at things that I've wanted to accomplish, and if I didn't accomplish them, or if it took me longer than I thought it should, then I really wanted to understand well, why was it that I wasn't able to do that? I say that I want this, but why is it so difficult for me to take the steps I need to take to accomplish it? So that's kind of where I go back to my work with these weight loss surgery patients in terms of asking, okay, what is the benefit of staying the same and not changing? Because there must be some benefit. People say, what's that saying? Something about the pain. Either you'll change.
No pain, no gain.
No, yeah, that too. But a person will change when the pain of staying the same is greater than the pain of changing. Because either way, it's going to be, accomplishing a goal is difficult. It's just, you've got to do things that you probably don't want to do and that maybe the average person won't do. But you have to look at, like I said, is there some benefit of not changing? Is there some benefit of staying the same? Do you, is it a relationship benefit? Is it a job benefit? Many people, didn't want to lose weight because they were afraid they would lose their relationship. They were afraid their partner wouldn't love them anymore if they became thinner, because maybe that person was overweight too, and now they felt threatened by, their spouse looking completely different and having more energy and looking better and feeling better. Yeah. So I think that's the first thing, is really, really looking inside to, how much do I say I want this, but how much do I want it? What am I willing to do to get it? And is the pain of staying the same greater than what it's going to take me to get off my butt and do it, essentially?
Yes. Yeah.
So I think that's the first thing. Unfortunately with weight loss, I've seen so many times it comes down to some traumatic event before people will do something. Meaning they're diagnosed with a life-threatening disease. They're diagnosed with type 2 diabetes or high blood pressure. So now they really have to, it's a wake-up call, and they now realize, oh my God, I can't stay like this anymore. I could die. So I have to do something. You don't want it to come to that, but a lot of times that's what it takes to make people change. Unfortunately, because they're too comfortable being the way that they are, even though they say they want to do something different.
What I like about what you're saying also is that there seems to be an interest, a marked interest in hearing what the person wants and where the person is. And I know that in the process of change, the person needs to see what's in the change for them. Right. And by you asking the questions that you mentioned before, that probably, makes the process more palatable for the person, because they're going after what is meaningful for them. So that sounds wonderful. And can you tell us a little bit about what people should expect to see, to experience on your workshop on June 10th, which again is going to be at Palabra Counseling Center in our Stamford office. We are located on High Ridge Road. It's very easy access from the Mary Parkway, and easy access from downtown Stamford as well in 95. So we're really looking forward to that. Give us some hints as to what to expect.
Yeah, absolutely. I mean, basically what I'm going to be doing is kind of taking people through our mini 12-week program. So we're going to be exploring everything from, like I said before, the fat loss myths. There's probably 5 mistakes that people are making in terms of their exercise and their diet and their mindset that's preventing them from losing weight and preventing it from being sustainable. So we'll cover what those mistakes are. I'll cover a little bit about the mindset like, do you how to know if you have a fixed mindset or a growth mindset, how you can, if you have a fixed mindset, how you can move towards having more of a growth mindset. We'll go through actual exercises of how to determine that, and then what you can, what steps you can take, which they're awesome. They're quick, little, easy things. You'd be surprised at how easy it is to change your mindset. It's really just about being aware of which mindset you have and listening to the things that you say to yourself in your head. Like earlier when you mentioned being kind to yourself, like that's a huge one. Mm-hmm. It's just being aware of the negative self-talk and being able to catch yourself, and then having strategies to, to move past that and say different things to yourself. So we'll get into a lot of mindset work. We'll talk about how to eat for effective fat loss, what kinds of exercise you should be doing. We'll talk a little bit about stress and hormones and how those things play a role as well. But basically, my goal is I want people to understand, what are things that they may have been doing wrong or thinking wrong in terms of weight loss, and then what they can take away from that, things that they can actually do on their own. So certainly if people are interested in our program, I'll have information about that, but there'll be definitely things that people can take away and do on their own after they leave that day, for sure.
Yes. So for more information on these, people can go to www.palabracounseling.org, and we have the information on the workshops there. So thank you so much, Diane, for this opportunity to hear more in depth about your plans, and I truly look forward to meeting you that day and welcoming all the participants in your workshop.
Oh, thank you so much. It was my pleasure, and I'm excited to be there too.